This ointment is used to prevent or treat eye infections and to treat swelling in the eye. It contains an antibiotic, sulfacetamide, that stops the growth of bacteria and a corticosteroid, prednisolone, that reduces inflammation. It treats only bacterial eye infections and should not be used for other types of eye infections. Unnecessary or overuse of this medication can lead to decreased effectiveness. The recommended dosage and timing for using this ointment should be determined by your healthcare provider. When using Blephamide S.O.P ointment, it's important to avoid wearing contact lenses. Be sure to wash your hands before applying the ointment and be careful not to touch the tube tip to your eye to prevent contamination. After applying the ointment, gently close your eyes for 1 to 2 minutes and try not to blink or rub your eyes. If you're using other eye medications, wait at least 10 minutes before applying Blephamide S.O.P ointment. It's important to use this medication regularly and for the full time prescribed by your doctor, even if your symptoms improve. If you have been using this medication for an extended period of time, do not stop using it suddenly without consulting your doctor. And if your condition does not improve after 2 days, be sure to inform your doctor. When using Blephamide S.O.P ointment, you may experience temporary stinging or burning in your eyes for a short time after application. You may also notice blurred vision, sensitivity to light, eye discomfort, dry eyes, tearing, itching, or redness. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist right away. It's important to remember that your doctor has prescribed this medication because they have determined that the benefits to you outweigh the potential risks of side effects. While many people using this medication do not experience serious side effects, prolonged or repeated use may lead to a new type of eye infection. Be sure to use it only for the length of time prescribed by your doctor and contact them if you notice any new or worsening symptoms. If you experience any serious side effects, such as changes in vision, eye pain, staining of the eyes, signs of infection, easy bleeding or bruising, yellowing of the eyes or skin, dark urine, or a severe allergic reaction, seek medical attention right away. And if you notice any other effects not listed here, don't hesitate to contact your doctor or pharmacist for further guidance. Before using Blephamide S.O.P ointment, make sure to inform your doctor or pharmacist if you have any allergies to sulfa drugs, corticosteroids, or any other allergies. This medication may contain inactive ingredients that can cause allergic reactions, so it's important to talk to your pharmacist for more details. Be sure to also inform your doctor or pharmacist about your medical history, especially if you have any eye problems, have had eye surgeries, or have diabetes. After applying this ointment, your vision may become temporarily blurred or unstable, so avoid activities that require clear vision until it is safe to do so. If you are pregnant, use this medication only if it is clearly needed and discuss the risks and benefits with your doctor. It is also unclear if the medications in this product pass into breast milk, so consult your doctor before breastfeeding. Drug interactions can affect how your medications work and may increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Blephamide S.O.P ointment are gentamicin, certain local anesthetics, such as tetracaine, and preparations that contain silver. Always consult your doctor or pharmacist before using this medication with other products. If this medication is swallowed, it can be harmful. If someone takes too much and experiences severe symptoms like fainting or difficulty breathing, it's important to call 911. If the symptoms are not as severe, you can call a poison control center right away. In the U.S., you can reach your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Remember, it's important not to share this medication with anyone else. This medication is specifically prescribed for your current condition, so be sure to dispose of any unused medication after your treatment is completed. Do not hold on to it for future use unless your doctor instructs you to do so. If you find yourself using this medication for an extended period of time, more than 10 days, it's crucial to schedule regular lab and/or medical tests, such as eye exams. Make sure to attend all of your medical and lab appointments, and consult your doctor for more information on this. If you happen to forget a dose of Blephamide S.O.P ointment, simply use it as soon as you remember. However, if it's almost time for your next dose, it's best to skip the missed dose and continue with your regular schedule. Avoid doubling the dose to make up for the missed one. It's important to store Blephamide S.O.P ointment at room temperature, away from light and moisture. Make sure not to store it in the bathroom and keep it out of reach of children and pets. When you no longer need the ointment or it reaches its expiration date, it's important to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do so. It's not recommended to flush the medication down the toilet or pour it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.